Question 23. In an experiment, a prokaryote is exposed to a high-intensity UV light, which causes a mutation in a gene. The mutated gene synthesizes a much shorter polypeptide chain than its normal gene. What type of mutation is this? The type of mutation is deletion mutation, which is a type of frame shift mutation, point mutation. Deletion is a type of mutation involving the loss of genetic material. One or more nucleotides are removed from a piece of DNA. Deletion really means that something is missing from the genetic material, and that is the reason why the mutated gene synthesizes a much shorter polypeptide chain than the normal gene. The deleted DNA may alter the function of the affected protein. Or UV light commonly damages DNA, which is also another reason for it to shorten. Question 24. In the future, you may be able to read your own genome and find out specific health risks. Would you want to know? What would be the advantages and disadvantages knowing our possible future? The researchers were able to insert a longer stretch of DNA into a nanopore similar to a needle's eye, resulting in comprehensive end-to-end sequence coverage for the whole insert. Individuals do not own their DNA or any other body tissue to that extent under present law, and this is valid. No one has original control over DNA because it is naturally occurring and cannot be changed outside of a laboratory. And if they did own it, there would be some unwelcome consequences right away. You may not have symptoms if you carry a gene or a rare disease. However, it may increase your medical expenses. The biggest benefit is that early detection may avert more severe types of sickness or the birth of a sick child in a couple. The biggest downside is that if an individual was not previously aware of an elevated risk of getting a condition with no cure, it may cause psychological stress. The major goal of genome sequencing is to collect medically useful information for future care. Even in asymptomatic patients, genomic sequencing can offer information on genetic variations that potentially cause disease or increase the risk of disease development. The majority of doctors aren't taught how to elevate genomic data. It's possible that a person's DNA contains information that they don't want to know. For example, a patient's genome is sequenced to find the most effective treatment. So would I personally want to know? Yes, because if I were to have a disease, then the treatment of the disease, like the chemotherapy for cancer, can be used so I can treat it before it gets worse, and I would have a higher chance to live if it is treated earlier. I can change my behavior and lifestyle, so possibly eating healthier to lower any risks of getting a disease or worsening it. However, the disadvantage would be the cost. It is pretty expensive to figure out how, like, to figure out your genetics and gene therapy. It costs over thousands of dollars or $1,000. Ethics, because it could be used against me and there could be privacy concerns. People may not be able to keep the information confidential. I could be getting stressed and have those psychological impacts because I may not be able to live life peacefully and compared to how I used to prior to knowing. And it might just cause a lot of stress knowing that I have a problem. But however, I feel like overall the advantages overpower, because if I didn't know and if I didn't get it treated and if I did not change anything and it got worse, then I could just possibly lose my life overall. So yeah.